and I'm speaking with David Roeder today, who's an epidemiologist from the School of Population Health at Adelaide, South Australian University, University of South Australia, sorry. First, I'm going to be giving an overview of breast cancer research that's been conducted in Australia over the last few years for Aboriginal and Torres Strait Islander women of Australia. Before I start, I'd like to acknowledge the traditional owners of the land on which we meet and the elders past and present, and to acknowledge and thank our distinguished guests, Auntie Di Kerr and other elders who are here today, and the Honourable Dame Quentin Bryce. Thank you very much for coming along. I'm going to be really brief. I'm just going to talk a little bit about the published literature, and then David's going to talk a little bit more about his research. How do I get back? So this is, as I said, quite recent work. What we know about the research that's been published is Indigenous women are more likely to be younger when they're diagnosed with breast cancer, to live more remotely, to live in lower socioeconomic areas, to have less breast screening, and we've talked about that today already with Auntie Di, and we'll talk about that a lot more today, I'm sure, and to have larger breast tumours. The research is also telling us that Indigenous women have some risk, some preventative factors for breast cancer, including having earlier years at childbirth, more children, less use of HRT. Indigenous women have a slightly lower incidence of breast cancer, but some data that's come out of the Northern Territory has shown that that's rapidly changing, that the rate is increasing. Indigenous women, as I mentioned before, do have larger breast tumours when they're diagnosed. Indigenous women are more likely to have more comorbidities. Alan Cass has touched on this already. We're talking about renal disease, diabetes, cardiac disease. All these things have to be taken into consideration when we're dealing with breast cancer. We know from work that's been done by Raj and other people that Indigenous women are less likely to have surgery. And if they do have surgery, are less likely to have breast-conserving surgery. They're more likely to have a mastectomy, and that's something I'm sure we'll talk about a lot today because that's important. There's many reasons for this. And are less likely to have breast reconstruction. In terms of breast screening, we've already touched on this. This will be a theme. Indigenous women are less likely to be breast screened and less likely to do breast self-examination, and strongly influenced by past experiences, and by that we mean bad experiences when they've engaged with the health system previously, and that's something that I think we'll explore in depth today. Don't even try and look at this. This is just a bit of a snapshot of the research that has been done today. A lot of it has addressed the fact that Indigenous status, Aboriginal status, isn't recorded well in medical records. I spoke with Auntie Marg last night. There's many reasons for this. It's at a service end, at the health service end, where we don't record this data well, and it's also at the other end where Aboriginal people don't feel safe about recording their Indigenous status, and that's something we really need to address. Other themes that have come out of the literature about being culturally sensitive in the care that we give people with their breast cancer, providing services that are acceptable to women themselves and to their communities, engaging the community from the very beginning, not at the end of the research. What else? And yes, we'll talk a lot about that today. And then I think David will just... You're on. Thanks.